welcome to your personalized deep dive into this world of in vitro diagnostics.
IVDD.
IVD, yeah.
Yeah.
You know, all those tests that happen outside the body,
Right.
like a pregnancy test or a blood sugar check or
Yeah.
even some of those fancy new cancer screenings.
Absolutely. It's a field that touches every single aspect of healthcare, and you've clearly got your finger on the pulse here, sending over market analyses, strategy guides, even research on AI diagnosing back problems. That's really impressive.
Well, let's be honest, sometimes it feels like drinking from a fire hose.
Yeah.
You know,
Yeah.
there's so much happening in IVD right now.
Sure.
It's this booming market with all this groundbreaking tech, and it's even starting to raise some ethical questions.
Yeah, that's
So today we're going to try to cut through all the noise and give you the insights you need.
Exactly. And I think this deep dive is about understanding where the industry is now, what's driving it, and most importantly, what it means for you.
Okay, so first things first, the IVD market is absolutely exploding.
It is.
We're talking $108 billion globally in 2024. On track to hit a massive $165 billion by 2030.
Yeah.
In the U.S. alone, it's expected to be worth over $65 billion by 2033.
That's a phenomenal growth rate.
Yeah.
And it's not just random chance.
Right.
There are some really powerful forces at play here.
I mean, this is where it gets interesting, for you.
Yeah.
With that kind of growth, I mean, knowing where to focus your attention, maybe even your investment,
Absolutely.
really becomes important.
Yeah,
And understanding the why behind the boom is key.
for sure.
So what is fueling this incredible expansion?
Well, I think there are three things, really. The first is the sheer speed of technological innovation in IVD. It is breathtaking.
Yeah.
We've got breakthroughs in molecular diagnostics, next-generation sequencing. Even at-home devices are changing the game.
Hold on, back up a sec. Next generation sequencing?
Yeah.
What is that in plain English and why should I care?
So imagine being able to map out your entire genetic code, every single gene, for less than the cost of a decent dinner.
Okay.
That's what next-generation sequencing, or NGS, can do. Companies like Illumina are making this a reality. Their NovaSeq platform can sequence a whole human genome for under $200.
That's mind-blowing.
It's mind-blowing.
Okay, so $200 to unlock the secrets of my DNA. Now that's something I can get behind.
Yeah.
What kind of impact is this having on healthcare?
Well, for one, it's paving the way for truly personalized medicine. We can identify your unique genetic predispositions to certain diseases and tailor treatments to your specific needs.
Okay.
And as the cost keeps dropping, this kind of personalized approach could become the norm, not the exception.
Okay, so NGS is a big deal.
It is.
But you also mentioned molecular diagnostics.
Yes.
What's that all about?
So molecular diagnostics dives into the tiny building blocks of our bodies,
Uh-huh.
DNA, RNA, proteins, to detect diseases at a much deeper level.
Okay.
Think of it like this. Instead of just looking at a blurry picture of a problem, we're zooming in to see the individual pixels,
I like that.
giving us a much clearer understanding of what's going on.
Yeah, I like that analogy. So what kind of real-world applications does this have?
Well, one really exciting development is liquid biopsies.
All right.
Companies like Guardant Health are using them to detect cancer earlier and less invasively.
Wow.
Imagine a simple blood draw could reveal the presence of cancer cells long before a tumor even forms.
Wow.
And they can also monitor how you're responding to treatment all through a blood test.
That's incredible. Early detection is key, especially with something like cancer. So we've got NGS, we've got molecular diagnostics, and then there's AI in the mix as well, right?
Absolutely. AI is becoming a really powerful tool in diagnostics.
Yeah.
Remember that research you sent about BioNet?
The AI that can spot back problems on MRIs? Yeah, it was pretty amazing.
Exactly. It's just one example of how AI is being used to analyze medical images, often with accuracy that rivals human experts. And it's not just about images. AI can predict disease progression, automate lab tasks, even help develop new drugs.
Okay, so this is all seriously cool tech.
It is.
But what's driving the need for it in the first place?
Well, that brings us to the second major factor fueling the IVD boom, the unfortunate reality of rising chronic and infectious diseases.
Right, things like diabetes, heart disease, cancer. We're seeing more of these conditions globally. And of course, we can't forget about pandemics.
Exactly. COVID-19 really highlighted just how crucial rapid and accurate testing is. And as our global population ages and health challenges increase, the demand for innovative IVD solutions will only continue to grow.
So we've got tech innovation pushing the boundaries and a growing need for diagnostics pulling the industry forward. But it's not a free-for-all, right? You
Right.
can't just whip up a new test in your garage and start selling it.
You're absolutely right. That brings us to the third major force
Mhm.
shaping the IVD landscape, and that's regulation. And for good reason, patient safety and the accuracy of these tests are paramount.
It makes sense. You mentioned the EU's IVDR in your notes. Can
Yes.
you tell us a bit more about that?
Sure. So the EU's In Vitro Diagnostic Regulation, or IVDR, got a major overhaul in 2022 with much stricter requirements for clinical evidence and oversight.
Right.
Companies selling IVD products in the EU now need to jump through a lot more hoops to demonstrate their tests are safe and effective.
And what about here in the U.S.? How does regulation work on this side of the pond?
So the FDA is the big player in the US, and they're also evolving their approach, particularly when it comes to AI-driven diagnostics and lab-developed tests. There's this proposed legislation called the VALID Act. It's generating a lot of buzz in the industry.
Okay, so the VALID Act. Can you give us a quick breakdown? What's it all about and why is it so important?
So in a nutshell, the VALID Act aims to streamline the approval process for diagnostic tests while ensuring their safety and reliability. It would create a new regulatory framework that's more flexible and adaptable to the rapid pace of innovation we're seeing in IVD.
It sounds like a much-needed update.
I think so.
But of course, any new legislation comes with its own set of challenges and potential controversies, right?
Exactly. There's debate over how much oversight is needed, how to balance innovation with patient safety, and how to ensure these advanced tests are accessible to everyone. It's a complex issue with a lot of moving parts.
All right, so we've got this booming market driven by tech advancements and a growing need for diagnostics, all while navigating a constantly evolving regulatory landscape. It sounds like a pretty intense playing field.
It is.
So who are the major players in this game?
Well, you've got the big hitters, the giants of the industry companies like Roche, Abbott, Thermo Fisher Scientific, and Siemens Healthineers. These are the established players with vast resources and global reach.
Okay.
They're involved in almost every aspect of IVD, from basic lab equipment to cutting-edge molecular diagnostics.
So they're kind of like the heavyweights of the IVD world.
Yeah, you could say that.
But are there any smaller companies shaking things up?
Absolutely. We're also seeing the rise of disruptors, companies like Guardant Health focusing on those liquid biopsies we talked about, and Grail, which is working on multi-cancer early detection tests. These are the companies pushing the boundaries, focusing on specific cutting-edge technologies, and really challenging the status quo.
It sounds like a dynamic and exciting industry.
It is.
But beyond the companies and the regulations, what does the future hold for IVD? Where is all this leading?
That's where things get really interesting. We're on the cusp of a new era of personalized and decentralized healthcare, and IVD is at the forefront of this transformation.
All right, now you've got me hooked. Personalized and decentralized healthcare. What does that actually look like? Break it down for me.
So imagine a world where your healthcare is tailored to your unique genetic makeup, lifestyle, and even your environment. That's the promise of personalized medicine.
So it's like getting custom-designed treatment plans based on who I am, not just a one-size-fits-all approach.
Yeah, exactly. And IVD is crucial for making this a reality test. Like companion diagnostics, which help doctors choose the right cancer treatment for each patient, and pharmacogenomic tests, which guide drug selection based on your unique genetic profile, are already changing how we approach healthcare.
That's incredible. But what about decentralized healthcare?
Well, think about the convenience of at-home testing. We've seen how popular those at-home COVID tests became, but that's just the tip of the iceberg. We're going to see more and more diagnostic tests moving out of the traditional lab setting and into people's homes.
So like having my own personal lab right in my living room. What kind of tests are we talking about?
Oh, all sorts. From monitoring chronic conditions like diabetes to testing for infections, even early cancer detection. Companies like Q Health are already making waves with their molecular COVID-19 test, which provides rapid results right at home.
Wow. So I could potentially take a test, have a virtual consultation with my doctor, and get my results all without leaving my house.
Exactly. And this shift towards decentralized healthcare is being fueled by consumer demand for convenience and the growing integration of telemedicine. But it also brings up important questions.
Yeah, like data security and privacy. If all the sensitive health information is being generated and transmitted digitally, how do we make sure it's protected?
That's a critical consideration. We need to ensure that patient data is securely stored, transmitted, and accessed. It's a complex issue and something we'll definitely want to explore further in part 2 of our deep dive.
Okay, this is fascinating stuff. We've covered so much ground already. The explosive growth of the IVD market, the incredible technologies driving that growth, the ever-changing regulatory landscape, and even peeked into the future of personalized and decentralized healthcare. My head is spinning.
It's a lot to take in for sure, but
Yeah.
we're just getting started.
Right.
In part two, we'll dive deeper into the ethical considerations surrounding these advancements, explore some specific applications of IVD that are already changing lives, and examine the challenges that lie ahead.
I can't wait. So be sure to join us for part 2, where we'll continue our exploration of this fascinating and rapidly evolving world of IVD. See you then.
See them.
Welcome back to our deep dive into the world of IVD. Last time we left off talking about this incredible shift towards personalized and decentralized healthcare.
Yeah.
I mean, it's pretty mind-blowing to think about, having access to all these advanced diagnostic tools right at our fingertips.
It is.
But it also makes me wonder.
Sure, of course, with all this incredible power comes a lot of responsibility.
Yeah.
And that's something we really need to carefully consider as these technologies become more widespread and accessible.
Exactly. So let's dive into those deeper questions. What kind of challenges do we need to address to ensure these advancements benefit everyone, not just a select few?
Well, I think one major concern is equity and access. We need to make sure that the benefits of IVD reach all segments of society, regardless of socioeconomic status, geographic location, or any other factors.
Yeah.
We don't want to create a healthcare system where only the privileged have access to the latest and greatest diagnostic tools.
That's a really important point.
Uh,
It would be a huge step backward if these advancements widened the gap between the haves and the have-nots in healthcare. So how do we prevent that from happening?
Well, it's a complex issue, but I think a crucial part of the solution is ensuring equitable access to healthcare in general.
Okay.
That means addressing systemic barriers like poverty, lack of insurance, inadequate healthcare infrastructure, especially in underserved communities.
Right. It's about creating a healthcare system that's truly accessible to everyone.
Mm.
But even if we solve the access issue, there's still the question of data security and privacy, especially as we move towards more connected healthcare systems.
Absolutely. Protecting patient data is paramount as IVD generates more and more information about our health. We need robust systems to ensure that data is stored securely, transmitted safely, and only accessed by authorized individuals.
Right.
We don't want to see this sensitive information falling into the wrong hands.
No, that would be a nightmare scenario. Data breaches and misuse of personal health information could have devastating consequences. So what kind of safeguards are being put in place to address these concerns?
Well, there are several layers of protection being implemented. First, strong data encryption methods are being used to scramble data, making it unreadable to anyone without the proper decryption keys. Think of it like putting your health information in a super secure vault that only authorized personnel can open.
Okay, so the data itself is protected, but what about controlling who has access to it?
Right. Well, that's where things like strict access controls and user authentication protocols come in.
Okay.
These systems ensure that only those with a legitimate need to access patient data are able to do so. It's like having multiple layers of security checks at the entrance to that vault, verifying the identity and permissions of anyone trying to get in.
Okay, that makes me feel a lot better. It sounds like there were some serious efforts being made to protect patient data. But with all this talk about security and responsibility, it's easy to forget about the incredible potential of these technologies to actually improve people's lives.
No, absolutely. It's important to keep that in mind and to really grasp the impact IVD is having. Let's shift gears for a bit and explore some specific applications that are already changing the game in healthcare.
Sounds good to me. Where should we start?
Well, oncology is a field where IVD is making a huge impact. Liquid biopsies are revolutionizing how we detect and manage cancer. Remember those companies we talked about earlier, like Guardant Health?
Yeah, the ones using a simple blood draw to find cancer cells?
Yes.
That's pretty amazing stuff.
Exactly. These tests can detect tiny fragments of tumor DNA circulating in the bloodstream, allowing for much earlier diagnosis and more personalized treatment strategies.
So instead of waiting for a tumor to grow large enough to be detected on a scan or going through invasive biopsies, we can now get crucial information from a simple blood test.
That's right. And the implications are huge. Catching cancer in its early stages dramatically increases the chances of successful treatment and survival.
That's incredible. So liquid biopsies are changing the game for cancer detection. But how are they being used to personalize treatment?
Well, by analyzing the tumor DNA found in the blood, doctors can identify specific genetic mutations that are driving the cancer's growth. This allows them to tailor treatments to target those specific mutations, making therapies more effective and reducing the risk of side effects.
So it's like taking a precision approach to fighting cancer instead of just using a one-size-fits-all treatment.
It,
That's got to be so much better for patients.
it really is. And liquid biopsies aren't just for initial diagnosis and treatment planning, they're also proving invaluable for monitoring how well treatment is working and detecting any signs of the cancer coming back.
So it's like having a continuous feedback loop, allowing doctors to adjust treatment strategies as needed. That's got to be reassuring for patients as well.
Absolutely. It gives them a sense of control and empowers them to be active participants in their healthcare journey.
This is also impressive. It's clear that IVD is making a huge difference in the fight against cancer. But oncology isn't the only area where these advancements are having a major impact, right?
Right. Another area where IVD is playing a critical role is in infectious disease diagnostics. And I think the COVID-19 pandemic really drove this point home for everyone.
Absolutely. Those at-home COVID tests became a part of everyday life for many of us,
They did.
but I have a feeling those were just the beginning.
You're right. We're now seeing even more sophisticated diagnostic tools emerging for a wide range of infectious diseases. For example, there are multiplex PCR panels that can detect multiple pathogens simultaneously from a single sample.
Well, hold on. Multiplex, can you break that down for me?
Sure. So PCR stands for polymerase chain reaction, which is a technique for amplifying specific segments of DNA in a multiplex PCR panel. You're essentially running multiple PCR tests at the same time, allowing you to quickly identify the presence of several different pathogens.
So instead of running separate tests for, say, the flu, strep throat, and COVID, you can do it all at once.
Exactly. And this is a game changer because it significantly reduces diagnostic delays and allows doctors to start the appropriate treatment much faster.
That's incredible, especially when time is of the essence with infectious diseases. But identifying the pathogen is just the first step, right?
Right. And thankfully, IVD is also helping us tackle another major challenge in infectious disease, antibiotic resistance.
Oh, right. Antibiotic resistance is a huge concern globally. How is IVD helping to address that?
Well, there are new tests that can rapidly determine which antibiotics a particular pathogen is resistant to. This allows doctors to prescribe the most effective treatment and avoid using antibiotics that won't work, which helps to slow the spread of resistance.
That's so important. It's like a targeted approach to antibiotic use instead of just throwing everything at the problem and hoping something sticks.
Exactly, and that's one of the most exciting things about IVD. It's giving us the tools to make more informed decisions about healthcare, both for individual patients and for public health as a whole.
I totally agree. And from personalized cancer treatment to tackling antibiotic resistance, it's clear that IVD is having a ripple effect across the entire healthcare system. But as with any rapidly evolving field, there are bound to be some challenges ahead.
Definitely, and those challenges are what we'll be exploring in the final part of our deep dive. We'll delve into the obstacles the industry needs to overcome, discuss what the future holds for this exciting field, and leave you with some key takeaways to ponder.
I'm ready for part 3. See you there.
See you there.
We're back for the final part of our deep dive into the world of in vitro diagnostics. We've covered a lot of ground, from the incredible growth of the market to the amazing technologies driving it all, and even peek into the future of personalized and decentralized healthcare.
It's been quite a journey,
Yeah,
but as with any field that's evolving this rapidly,
right.
there are bound to be some bumps in the road.
Exactly. So let's talk about those challenges. What are some of the biggest hurdles the IVD industry needs to overcome to truly reach its full potential?
Well, one of the first things that comes to mind is the complex regulatory landscape. We touched on this earlier with the EU's IVDR and the proposed VALID Act here in the U.S.
Right. It's a delicate balancing act between ensuring the safety and effectiveness of new tests while also fostering an environment that encourages innovation.
Precisely. And that approval process can be lengthy and expensive for companies, which can sometimes stifle the development of new and potentially life-saving technologies.
It's like a catch-22. You need rigorous testing to prove a test is safe and effective, but that testing takes time and money, which can make it difficult for smaller companies or startups to get their innovations off the ground.
Exactly. And then there's the issue of reimbursement. Even if a company develops a groundbreaking new test, it won't make much of an impact if patients can't afford it or if insurance companies refuse to cover it.
That makes sense. It's not enough to just develop amazing technology. You also need to make sure it's accessible and affordable for the people who need it most.
Absolutely. And then there's the whole issue of data management as IVD generates more and more data about our health.
Right. We need robust systems to store, analyze, and share that information securely and ethically. Right. We talked about data security and privacy earlier, and it seems like this becomes even more critical as we move towards more connected healthcare systems.
Definitely. Striking that balance between utilizing data to advance research and personalized medicine while safeguarding patient privacy is going to be a constant challenge.
It sounds like there's a lot to grapple with.
There is.
But despite these challenges, there's still a sense of optimism surrounding the future of IVD, wouldn't you say?
Oh, absolutely. The potential for IVD to transform healthcare is just too great to ignore, and there are some incredibly exciting trends emerging that are fueling this optimism.
Like, what's getting you excited about the future of IVD?
Well, one of the most thrilling trends is the convergence of IVD with other cutting-edge technologies like artificial intelligence and machine learning. We already talked about how AI is being used in image analysis and diagnostics.
Right,
Yeah.
like that BiancaNet AI that can spot back problems on MRIs with incredible accuracy.
Exactly. But this is just the tip of the iceberg. AI is being used to develop more sophisticated diagnostic algorithms, to analyze complex data sets and identify patterns that humans might miss, and even to automate lab processes, making testing faster, more accurate, and more efficient.
So it's not just about AI being a tool for diagnosis, it's also transforming the entire IVD workflow.
Precisely.
Yeah.
And this is leading to some incredible advancements. For example, researchers are using AI to develop personalized risk assessments for a wide range of diseases. Imagine being able to get a personalized report that tells you your individual risk factors for developing heart disease, cancer, or Alzheimer's based on your genetics, lifestyle, and other factors.
No, that'd be amazing. It would allow people to take proactive steps to manage their health and potentially prevent those conditions from developing in the first place.
Exactly. And that's the power of personalized medicine. And another trend I'm particularly excited about is the rise of point-of-care testing.
We talked about this with at-home testing, but you mentioned it goes beyond that.
Right. Point of care testing is all about bringing diagnostic testing closer to the patient, whether that's in a doctor's office, a pharmacy, a remote clinic in a developing country, or even your own home.
So it's about increasing access to testing regardless of location or socioeconomic status.
Exactly. And this is being made possible by the development of portable, easy-to-use diagnostic devices that can deliver accurate results quickly and efficiently.
Can you give me an example of what this looks like in the real world?
Sure. Imagine a healthcare worker in a remote village in Africa being able to use a handheld device to diagnose malaria or HIV within minutes without having to send samples to a distant lab and wait days or even weeks for results. Or a doctor in a rural clinic being able to test a patient for strep throat right there in the exam room and get results almost immediately.
Wow, that's incredible. It would revolutionize healthcare in areas with limited access to traditional laboratory services.
It really would. And it's not just about remote or underserved areas. Point of care testing can also benefit patients in developed countries by providing faster results, reducing the need for multiple appointments, and empowering patients to take a more active role in managing their own health.
It's amazing to think how far IVD has come and the incredible potential it holds for the future of healthcare.
It truly is. The IVD industry is a hotbed of innovation, and the pace of progress is only accelerating.
So as we wrap up our deep dive, what's the one key takeaway you'd like to leave our listener with?
Well, I think the IVD industry is at a pivotal moment. It's a dynamic and rapidly evolving field that's already transforming healthcare as we know it. With its potential to personalize medicine, diagnose diseases earlier, increase access to testing, and even help us tackle global health challenges like antibiotic resistance, IVD holds immense promise for improving patient outcomes worldwide.
It's been an incredible journey exploring the world of IVD with you. Thanks for sharing your insights and expertise.
It's been my pleasure, and to our listener, keep asking questions, keep learning, and keep exploring the fascinating world of in vitro diagnostics. The future of healthcare is being shaped right now, and it's an exciting time to be a part of it.